Hi, my name is AJ and I'm a nurse here at the Ward Institute. Today we're going to be talking about a face and a neck lift and how to care for yourself and what to expect after surgery. A lot of our clients that come in for a face or neck lift, it is one of the larger surgeries that we perform here at the Ward Institute. Typically the surgery can last from anywhere from 5 hours to 8 hours long. So it's a little bit longer of a day on your body. After surgery, you'll be taken to a recovery room with a registered nurse and we'll go over specific aftercare instructions. But these are some of the generalized aftercare instructions. When you wake up from surgery, you'll have a very compressive device that we put around your neck called a jaw bra, and that will be stuffed with gauze. That's mostly there to provide compression to help with any swelling or bruising after surgery. It's a nice tight, you kind of look like a mummy with it on. You'll have incisions typically about a 1 to 2 inch incision underneath your chin here, and then you'll have incisions along your hairline and behind your ear. You could also be going home with 1 or 2 drains. Sometimes we typically place in drains to allow for any additional bleeding or swelling that can occur underneath the skin to be drained into a bulb in which you'll empty. Typically, if you have a bulb placed or a drain placed after surgery, we make a day 1 post-op appointment so that we can see you in office. A registered nurse will see you during that visit, kind of assess your drains and assess your wounds. We'll also help you with that kind of your first dressing change and take a look at all of those surgical incisions underneath those dressings. Typically, we can remove most drains within 24 hours, but if they are still putting out enough drainage, we typically could leave them in upwards to a week. Immediately following surgery, we do our best to kind of wash your hair and pull it in an upright, like top ponytail, and then we apply all of your dressings. And then once in recovery that your vital signs are stable and you can give me a thumbs up, I bring your loved one or whoever's taking care of you after surgery back into the recovery room so we can talk instructions. After surgery, you can resume your diet and kind of advance it as tolerated. We recommend starting off with easy to digest foods such as smoothies or soups until you kind of feel a little bit better. So sometimes it can take about 24 to 48 hours after surgery until you feel like you have your kind of appetite back. At that point, we'll kind of tell you if you have any restrictions to any of the foods that you can eat. You might find it difficult with all of the swelling and all of the dressings on your face to eat very chewy or hard to eat foods. A registered nurse will tell you what home medications can be safely restarted, and they'll go over what post-op medications and when to take them for your surgery. And then they'll let you know of any additional wound care or if we need to see you in office the following day to assess any drains that may have been placed. Once you see us in office after your day 1 appointment, you'll be kind of in charge of your own wound care at that point, in which case what you'll do is you'll take a Q-tip and some hydrogen peroxide and you'll clean along all of the incisions or anywhere that there's sutures on your skin. So especially after a face or a neck lift, you'll be cleaning the incisions up against your hairline, behind your ears, underneath your chin, in that area, and then you'll be applying any mupirocin, Vaseline, or Aquaphor to that area, and then you'll put your own dressings back on, the jaw bra and all additional gauze or dressings like that. It's very important after surgery to sleep with your head slightly elevated or your head at least above your heart, and with your head and neck in a kind of neutral midline position, so not laying on your side or your stomach at all. Swelling typically worsens within the first 3 to 5 days where it kind of reaches its peak, and then around a week you'll start to notice some subtle improvements with the swelling. Swelling can still be significant for 1 to 4 months after surgery. We tell all of our clients it's fully about 9 months to a year until you see the full results once that swelling comes out of your face. Noticeable swelling is around 4 to 6 weeks that you'll notice a big difference and a big change with. You may also experience bruising in certain areas as well as swelling. A lot of people ask what their scarring is going to be like after having a facelift. Most of the incisions that are made in order for us to perform a facelift are actually pretty well tucked in and hidden in places. As I mentioned earlier, you'll have a small little scar underneath your chin here that really you won't be able to see unless you have your head fully tilted back. And then you'll also have some incisions that are almost tucked underneath your hairline that go down and around your ear. Those heal very nicely, and they kind of have a natural camouflage with being tucked within your hairline or behind your ear. Typically those heal very well. You can take those incisions, they generalize heal and close together so that we can remove your sutures within 6 to 10 days. However, the sutures themselves and that scar in that area can take several months till they'll fully heal. You might notice some redness or some swelling in the area, and that's totally normal as well. We recommend in the first 7 to 10 days that your jaw bra be worn at all times unless you're showering or doing any incision or wound care. The more compression, the more time you spend in that jaw bra, the better your results will be, and the faster your healing is going to, occur. The faster you'll get rid of some of that swelling in that area. In the following weeks and months following surgery, we highly recommend wearing the jaw bra at least at night. We understand that you have to go back to work and you have a life that you need to get back to. So it may not be feasible for all people to wear that jaw bra 24 hours a day, but if you can at least wear it at night during the first few months of your recovery, that can make a huge difference and a huge improvement with your results.